Thank you so much to Eve for such a great presentation to start us off with. So as Lawrence mentioned, my name is Olivia Magwood. I am a fellow with the Cochrane and Campbell Equity Methods Group and a research associate at the Bruyere Research Institute in Ottawa, Canada. And today I will be sharing a little bit about what we know about stakeholder engagement in systematic reviews and how this might contribute to equity so that those of you listening can make some of these considerations in your own reviews. So today I'll go over who we consider stakeholders to be and how we are looking at engagement, as well as why you might consider engaging diverse stakeholders in your reviews and when and how they should be engaged. And then I'll be closing off with some ongoing work by members of the Campbell and Cochrane Equity Methods Group that you may be interested in hearing about. So to begin, who are the relevant stakeholders that might be interested in being engaged in systematic reviews? We consider stakeholders to be any individual or group who is responsible for or affected by these health-related decisions. And in the table on the slide, you can see 10 groups that we use in the Cochrane and Campbell Equity Methods Group to conceptualize stakeholders. So these include patients and patient organizations. Some people prefer the term consumers. And it also includes people such as providers of care and policymakers, program managers, and payers of services and health research. Next, we might need to think about what we consider to be engagement. We have defined engagement as an active partnership between stakeholders when producing knowledge and evidence. We think that this may result in informed decision-making about the selection, the conduct, and the use of research. So stakeholders can help us think about what research needs to be done, how it is done, and how it may then be used to inform decision-making. We also recognize that different groups around the world use different terms when talking about engagement, and you may have also heard the terms collaboration, involvement, or partnership. Now, when we think about stakeholders in reviews, we might want to reflect on why it is that we are engaging these folks. And we have thought about how research findings might be used, and engaging stakeholders can actually increase the uptake of the research we produce, improving dissemination and the ultimate utilization of findings. But before we even get to dissemination, we can actually think about how and why we might engage stakeholders earlier in the process. And one thing that's particularly important is when we're making recommendations for research or interpreting our research findings, they can really help us think about a more equitable evidence base. And I've included a quote here on the bottom of the slide that speaks to this point. And it says, "The insights that stakeholders provide are the key to ethical decision making, which is the only sustainable solution to inequities." Now, Roses Parker and Eve, who just presented, have come up with a list of factors to consider when we are inviting individuals to join a multi-stakeholder research partnership. So these are 10 factors that you might consider when we are including stakeholders in our reviews. Some of these include the ability and the willingness of an individual to represent a particular stakeholder group. And we know that these individuals need to come with particular skills in communication and resources and time to be able to participate. They also need a level of expertise or experience in the domain of interest, so on the topic of your review. And we need to make sure that as a group who is inviting these individuals to work with us, that we maintain an approach of inclusivity and offer training and support so that these people can meaningfully participate with us. Now, there are several models for engagement, and some people consider this along the engagement ladder. At the bottom, these are items or activities that many people consider as being doing to individuals and doing for individuals. And at the very top, we have co-production and partnerships, which is what we consider to be doing with individuals. In our team, we have simplified this and we've identified two major roles that stakeholders can play during reviews. The first is the higher level decision-making role, where stakeholders get an equal vote at the table when making decisions about the research we are conducting. And then at the lower level is advice or feedback, where they can give us their thoughts and insights into the topic or into the approach that we are taking. Once we know who we might want to involve and what level of decision-making authority we'd like to give them, we then need to think about when these stakeholders will be engaged in our project. And just as Eve highlighted previously, we need to think about equity and engagement right at the beginning of our project. So this includes when we are putting our team together and deciding who will play what kind of role in the project. We should also engage stakeholders when we are selecting or prioritizing our topics and developing our review questions. Stakeholders can also help us identify gray literature sources and other evidence databases that us as researchers may not think about. And their input can be particularly useful in ensuring that we present our outcome data in a way that can really inform stakeholder needs. And often this might mean that we develop other outputs or other products that are more user-friendly. When we engage stakeholders, there are a number of equity considerations that we also might need to think about. So when putting together our team, we need to ensure that equity values are considered as part of the team values and culture. So the members on your team need to foster a feeling of equity and inclusivity so that they are open to hearing different perspectives during the review process. One potential way to get there would be for review members to participate in some kind of equity, diversity, and inclusion training. It's also a great idea to include people with lived experience as part of the team. And what we mean by this is that this might be an individual who has past or present experience with a particular condition of interest, or who may have experienced, engaging with the intervention that you are studying as part of your review. When we work with these folks, we need to ensure that as a team, we are monitoring the power imbalances that might go on, and we need to address these so that there can be equitable decision making within the team. And finally, we need to ensure that our stakeholders are given adequate time, resources, and support to be meaningfully engaged. Unlike ourselves as researchers, these stakeholders may be playing other roles and have many other responsibilities, and we need to be respectful of those in order to work with them well. And finally, I'd like to share some of the upcoming work that is coming out of this. So just last year, members of the Cochrane and Campbell Equity Methods Group were awarded money to do a 4-year project focused on exactly this, so how we can engage stakeholders in reviews. And we have 3 main objectives that we will be working on over the next 4 years. The first is to develop guidance on methods for stakeholder engagement. And this includes methods for how they can be engaged in priority setting, in the conduct of the review, and in the eventual dissemination and knowledge translation of the findings. We also plan to develop or adapt a reporting guideline for stakeholder engagement in systematic reviews. And finally, we will be providing some guidance on how you can evaluate stakeholder engagement in systematic review steps. This project is expected to take a series of steps over the next 4 years. We will be doing a series of systematic reviews on methods, and barriers and facilitators, and existing guidance that is out in the published literature on how we can engage stakeholders in research and reviews. We will then be planning a series of interviews and surveys with key informants and systematic review authors to understand when and why they engage stakeholders and to draft a guidance checklist. We'll then host a consensus meeting where we will finalize our checklist and guidance documents, and then work with groups like Cochrane and others internationally to disseminate this to relevant organizations who might be able to benefit from stakeholder engagement in their own work. And if this project is of interest to you, we are still in the early days. So I encourage you to check out our website, which is a project page on the Cochrane and Campbell Equity Methods Group website, where there is also a list of publications that covers some of the key items I covered in this presentation. And finally, you're also welcome to contact Jennifer, who is the coordinator for our group and also the coordinator for this overarching upcoming project. Thank you very much. I'm happy to take questions.
Thanks, Olivia, for that excellent presentation. And it's exciting to see that we shall probably be in the near future capable of formalizing, understanding, and measuring stakeholder engagement in evidence synthesis. So I do not see any questions in the chat, but I have one question for you. On one of the slides, you mentioned supports for stakeholders. Are you aware of any resources that can be used to build stakeholder capacity to prepare them for engagement?
Yes, so in Canada, we have a group called SPORE that does patient-oriented outcome research, and they have developed a training resource that's available online to engage different types of stakeholders in rapid reviews, which, as we all know, follows many of the same steps as systematic reviews. So that's just one of the options that you can consider. And our group also has a paper that's soon to be published, I believe, in JCE that Omar Duadar, who I know is on this call, has co-authored and led. And that paper will include some great tips, tricks, and key ideas to consider when engaging people in reviews.
Wonderful. I do have one more question, and it is related to stakeholders who do not belong in only one of the groups you have mentioned. Do you have any recommendations for how to manage stakeholders who might be patients and advocates, or maybe clinicians and advocates at the same time, and that sort of overlap in stakeholder roles?
That's such a fantastic question because many of us do wear multiple hats. So we do fill multiple stakeholder roles, and this isn't necessarily a bad thing. It can be really advantageous for somebody to bring multiple perspectives to the table or who might have different experiences. What I would say is particularly important is, for the review team at the very beginning to think about what types of stakeholders are needed in their project and to do a bit of a stakeholder mapping or identification exercise to think about what roles are most important to their review. One of my earlier slides showed 10 groups, and it might not always be necessary for all of those 10 groups to be engaged.
So we have one question which is addressed to any of the speakers, so either Eve, Olivia, or Chris. It's from Kate Nihan. I support various evidence synthesis projects at my institution as a medical librarian, but very few of them explicitly address equity. Any suggestions about how to integrate equitable approaches into existing projects, even if they were not developed with equity in mind? Any of the speakers can take this.
Olivia, you looked primed to go there. I don't know if
it's a very exciting question. I'm just rereading it. No, it's fantastic. I'm so happy that people are thinking about equity. And while we'd love to see them thinking about equity from the beginning, often this isn't the case. And we realize partway through that, oh, we may have forgotten something and, we need to integrate equity at a later point. Obviously, from my perspective, one thing you can consider is to engage stakeholders even at this later stage, because they may still have really useful advice on how you can be thinking about equity. And depending on the type of project that you're doing, if you have the opportunity to introduce some kind of equity analysis, such as a subgroup analysis that's stratified by Progress Plus, or looking for differences in outcomes based on different characteristics, this is something else that you can consider. Eve, I'm not sure if you have any other ideas based on the equity effectiveness loop.
No, I mean, I completely agree with what you've said there. I think also you can, even if you're not able to do that in the project that you've started, you could think about the applicability of your results to priority populations and think about if you're going to be updating the work, broadening the scope next time to kind of look into that a bit more. But yeah, I think I completely agree with what you said there, Olivia.